News Queensland's to trial birth control pharmacy prescriptions. So, in some states and territories, the rules are slightly different, but in Queensland at the moment, access to hormonal contraception is through a prescription from a medical prescriber. Now, how significant is that from July, women in Queensland will be able to access a range of contraceptives, including the pill, straight away through their local pharmacist. Yeah, well, that's right. This is a groundbreaking initiative, and it's wonderful for access to greater health outcomes for our communities, especially rural and remote areas where sometimes it's very hard to see your local healthcare provider. So this plan is going to leverage of the accessibility of your local community pharmacist, who is quite often up and extended hour, late nights, weekends, is really going to improve hormonal contraception accessibility for Queenslander. Now, it's someone who will work as a pharmacist in regional area across the country. What kind of impact will this demand have on the pharmacists themselves? Yeah, that's right. So pharmacists will need to undergo an accredited training course to be able to qualify for the pilot. And it's really just pharmacists are very well placed to promote quality and safe use of medicines in the community. So pharmacists are very well placed to be able to participate in such a plot. Do you believe the training will be vigorous enough, because this is giving quite a bit more responsibility to pharmacists to take some of the pressure off GPs? Will they be well equipped enough to take all that on? That's right. Well, it is an accredited training course at the consultation to be able to supply the medication will be intense consultation where the pharmacist will have to ascertain and follow the appropriate steps to ascertain whether then the prescription is going to be safe and effective for the consumer. You mentioned that it varies from state to state in terms of access to contraceptive pill. Where does Queensland sit in that spectrum? Yeah, that's right. So at the moment, yeah, Queensland fall under the with women having to access the prescription through a medical practitioner. And in future, do you see more states and territory taking up measures like this to make it more accessible to people outside of GP's office? Yeah, absolutely. So currently, ACT and New South Wales have a version of this whereby pharmacists can continue supply of oral contraceptive medication. Where this applied is going to be different will be that Queensland pharmacists after undergone the training will be able to initiate the therapy. And what do you see the long-term benefit here of this being as somebody who's worked in this sector and in rural area in particular? How beneficial will this be to women in this area? Remarkable access to contraception shouldn't be a luxury, but rather a basic healthcare need. So, without a question, it's going to do great things for um, access to hormonal contraception for Queensland women. If you look at the global scale here, much of Asia, Africa, South America, the access to the pill doesn't require a prescription. Based on your experience in pharmaceuticals, do you see a time when Australia will join that list? I think that's why we do political programs like this, so we can roll out and see the benefit state by state. That's traditionally how our industry was worked so far. So I mean, we would be great to think that one day we can get that sort of level. Queensland pharmacist Jacqueline Mice, thank you for joining us. One more. So, in some states and territory, the rules are slightly different, but in Queensland, is at the moment access to hormonal contraception is through a prescription for a medical prescriber. Now, how significant is that from July, women in Queensland will be able to access a range of contraceptives, including a pill, straight away through their local pharmacist? Yeah, well, that's right. This is the groundbreaking initiative, and it's wonderful for access to a great health outcome for our communities, especially rural and remote area where sometimes it's very hard to see your local healthcare provider. So this plan is going to leverage of the accessibility of your local community pharmacist who is quite often up an extended hour, late night, weekends, and it's really going to improve hormonal contraception accessibility for Queenslander. Now it's someone who has worked as a pharmacist in regional area across the country. What kind of impact will this demand have on the pharmacists themselves? Yeah, that's right. So pharmacists will need to undergo a credit training course to be able to qualify for the pilot. And it's really just pharmacists are very well placed to um, promote quality and safe use of medicines in community. So pharmacists are very, very well placed to be able to participate in such a pilot. Do you believe the training will be vigorous enough because it's giving quite a bit more responsibility to pharmacists to take some of the pressure off GPs? Will they be well equipped enough to take all that on? That's right. that is increased training course and the consultation to be able to supply the medication will be an intense consultation where the pharmacist will have to ascertain and follow the appropriate steps to ascertain whether the prescription is going to be safe and effective for consumer. You mentioned that it's vary from state to state in terms of access to contraceptive pill. Where does Queensland sit in that spectrum? Yeah, that's right. So at the moment, yeah, Queensland fall under the with women having to access the prescriptions through a medical practitioner. And in future, do you see more states and territory taking measures like this to make it more accessible to people outside of GP's office? Yeah, absolutely. So currently, ACT and New South Wales have a version of this whereby pharmacists can continue supply of oral contraceptive medication. Whether this applied is going to be different will be that Queensland pharmacists, after undergoing the training, will be able to initiate the therapy. And what do you see the long term benefit here of this being as somebody who's worked in this sector and in rural area in particular, how beneficial will be to women in this area? Um, Remarkable. Access to contraception shouldn't be a luxury, but rather a basic healthcare need. So, without question, it's going to do great things for access to hormonal contraception for Queensland women. If you look at the global scale here, much of Asia, Africa, South America, the access to the pill does require a prescription. Based on your experience in pharmaceutical, do you see a time when Australia will join the list? Look, I think that's why we do apply program like this, so that we can roll it out and see the benefit state by state. That's traditionally how our industry works so far. So, I mean, would it be great to think that one day we can get this sort of level? Queensland pharmacist Jacqueline Martin, thank you for joining us. Thank you.